Biomarkers are measurable indicators of characteristics that provide information about the presence, progression, or severity of conditions such as Parkinson's. In Parkinson's research, several types of biomarkers are being studied. These include imaging biomarkers, which involve techniques like MRI, PET scans, and SPECT scans to visualize brain changes and dopamine levels. These also include biochemical markers, which assess specific molecules or proteins associated with Parkinson's in body fluids such as spinal fluid, blood, or urine. We also have genetic markers, such as genetic mutations and variations, which can be studied to understand the genetic basis of Parkinson's. And finally, we have clinical biomarkers, which are based on observable clinical symptoms and motor function assessments, and can measure motor abnormalities even in the very early stages of Parkinson's. Biomarkers are really important in Parkinson's research, as they help researchers understand the underlying mechanisms of Parkinson's, which can then lead to the development of therapies for Parkinson's. They also help in assessing the risk of developing Parkinson's disease in at-risk individuals. They help facilitate the evaluation of experimental drugs and therapies in clinical trials. And finally, they help researchers to understand factors that may lead to a more or less severe disease. Biomarkers also serve an important role in Parkinson's management, as they allow for an early and accurate diagnosis of Parkinson's, which can mean earlier interventions, and this can improve patient outcomes. They also aid in identifying subtypes of Parkinson's, ensuring that patients are offered the best possible treatment options. And they provide a means to track disease progression and treatment effectiveness over time, which allows clinicians to adjust treatment plans accordingly. In PredictPD, we are committed to advancing Parkinson's biomarker research. We've recently received funding to be able to develop and incorporate the alpha-synuclein seeding assay into the study. This is a recently developed biochemical diagnostic test for Parkinson's. We've also been able to collaborate with the Parkinson's Progression Marker Initiative, known as PPMI, and the Global Parkinson's Genetics Program, known as GP2. Through these initiatives, we will continue to explore biochemical, genetic, imaging, and clinical biomarkers in the PredictPD cohort to further develop the PredictPD risk algorithm and add to the understanding of Parkinson's.